All right, now I want to talk about chronotropy. So chromatropy is the pace at which your heart rate. So we can pretty much call it heart rate, but it's the ways that it's controlled. So if we're talking about positive chronotropy, positive would mean we're increasing our heart rate. The way we're going to do that is again through the beta 1 receptor, which is ultimately going to increase adrenaline cyclase, which is ultimately going to increase our CAMP, just like it did before, talking about the same CAMP here. But there's a couple different things, what's going to happen here. So our CAMP, it is actually going to cause open HCN channels, which are our funny channels. HCN stands for hyperpolarized or cyclic nucleotides, which is what causes them to open. So open HCN, which causes more Na plus to come in, which causes more depolarization as more calcium is going to come in. This is also going to result in, making sure I say this right. Right. So our CAMP is also going to increase our pKa, that phosphokinase A molecule, and that is going to result in an increase in calcium influx from that. So let's say phosphorylation of CAL channels. An increase in calcium channels is it's going to increase resting membrane potential, which means making our cell more positive overall, which means it's more easily excitable. But as we increase calcium channels, or as we increase calcium levels inside, we're also going to be decreasing extracellular calcium, which means our resting membrane potential now lowers because there's not as much calcium holding the mechanism shut. So we're going to, I guess the word would be decrease wait, did I say that right? No, that's right, RMP, and then over here we're going to decrease our threshold. And that's how you do positive regulation of positive regulation of chromatropy. So all of these are going to ultimately result in a higher heart rate. And then we talk about our negative regulation. So we're going to be using acetylcholine plus an M2 receptor. And that's ultimately the pathways is it's going to come and attach to the beta dimer, well I should write GERK with the beta gamma, and then the other gamma subunit is going to come attached to another GERK channel, which is going to decrease ICF K+. Well, really what it does is it increases K+ leak channels, which ultimately causes an decrease in resting membrane potential. So if we were talking about our chart for our autorhythmic cells, if our normal looks like this is threshold, our new one is going to look something more like this. It just takes longer to get there as we decrease our resting membrane potential. And the opposite is true for up here as well. I guess I could show you. If that is our normal, our new one is going to get there much sooner. So more excitable. The other way this could happen is these actually release something called an alpha subunit as well. And that alpha subunit is going to come and decrease CAMP. Now as we decrease CAMP, we're going to have two different things happen. The first thing that's going to happen is we're going to decrease our funny channel, our HCN, which means as we decrease HCN, we're not polarizing as frequently as we once were. So that decreases the rate via that way, decrease in the heart rate, but decreased CAMP, or this will also result in less calcium being opened. Less Ca2 plus coming into the cell. So besides the fact that calcium, we were having less depolarization events overall, just like up here when we decrease extracellular calcium and we lower the threshold, as we increase extracellular calcium, because we're not bringing it into the cell as much, what's going to happen is we're going to increase threshold. And that's why.